A 4-year-old female tiger at New York City's Bronx Zoo has tested positive for the coronavirus. Officials say Nadia first began showing signs of the virus on March 27th after developing a dry cough. They say the tiger was exposed to an asymptomatic worker at the zoo. 6 other large cats are also showing symptoms, but they are all expected to be okay. Authorities believe it is the first confirmed COVID-19 infection of a tiger in the U.S. Brian Larsen joins me now. He's a registered nurse and CEO of RestoraPet, a health supplement company for pets. Hi, Brian. Thanks so much for joining us. So, can humans get coronavirus from animals?
Yeah, so there's currently no evidence whatsoever that humans can get COVID-19, the current coronavirus, from animals. We are seeing these rare instances of animals, pets getting coronavirus from humans, but ultimately we believe that this is really a minimal risk, and we believe that some basic steps, some precautions are going to be able to protect against this.
And so if your pet is showing symptoms of, respiratory distress or other symptoms as this tiger at the Bronx Zoo was showing, should you try to get your pet tested for COVID-19?
Yeah, so routine COVID-19 testing among pets is really not something that's occurring. And again, it's very, very unlikely that if a pet was demonstrating some upper respiratory symptoms, that would be due to COVID-19. We have seen instances of cats being infected with COVID-19 in the lab, and they were ultimately asymptomatic. And there have been 2 dogs that have been known to test a week positive for coronavirus. Those dogs also were asymptomatic. Ferrets, as a sort of unique group that are sometimes household pets, can demonstrate a fever and a cough and can be infected with COVID-19, but they're sort of something of an outlier at this point.
And don't scientists believe, though, that this particular virus, this particular coronavirus, originated with animals?
Yeah, it's absolutely true. So coronaviruses are unique in the fact that they have a little protein spike that ultimately is able to attach to certain cells. And that little protein is rapidly mutating. And ultimately, that protein was able to, we believe, go from a bat to ultimately infect a human. And that ACE2 protein, that protein is common among a number of pets. So that's part of the reason why you're seeing this get ultimately adopted in some pets and those pets being infected, but those pets are not symptomatic, and it's not believed that they can transmit the disease back to humans. But yes, that is what is so dangerous about COVID-19, is the fact that it is able to rapidly evolve and mutate.
And so if you happen to be unlucky enough to, become infected with this virus, you're quarantining yourself. Should you also quarantine yourself from your pet? Could your pet then, carry some of the virus on his or her fur to other family members in your house?
Absolutely. So, I mean, we know that the coronavirus ultimately is able to survive on surfaces for hours to days. And if nothing else proves to be true, we know that a pet's skin and fur is ultimately a surface that can theoretically harbor COVID-19. So if a person is infected with COVID-19 or believes they may be infected, then in the same way that they really should be quarantining from other human members of the family, they should be quarantining from their pets. And that might include having someone else provide care for the pet if at all possible. If that's not possible, then the same precautions that would be true for human-to-human transfer risk, meaning proper hand hygiene being critical, needs to also be observed with the pet. So that means washing your hands thoroughly for at least 20 seconds, providing the necessary care, and then washing your hands again for 20 seconds before and after contact.
It is such a bitter pill for a lot of quarantine people to swallow. I mean, if they've gotten themselves shut off from the rest of their family in a basement or a room, to then not be able to derive some comfort from the family pet on top of that, it must be so difficult. But you say with precautions, you can sort of share the pet among household members as long as you're very, very careful about it.
That's right. I mean, pets are full-fledged members of the family, right? We all hopefully believe that. And so ultimately, these basic precautions and this limited duration of time by which we need to observe these very stringent precautions will ultimately ensure that we're all living long, healthy lives, enjoying our pets and the other members of our family.
So I'm just curious because we know that the COVID-19 test for humans is often very uncomfortable. Is it the same test when you're testing an animal for this virus?
Yeah, so it really depends on the animal. Ultimately, it is a nasal swab. They can also do oral and rectal swabs as they did in the canine examples of COVID-19. But when you think about, for example, the tiger at the Bronx Zoo, as you mentioned, there are now multiple animals that are showing symptoms of COVID-19. Because it was a tiger, they ultimately had to put the tiger under general anesthesia. And that's precisely the reason why they're not testing the rest of the animals that are displaying those symptoms. They believe that they are a presumptive positive. But yes, in this case, it's a nasal swab that they're doing. And but you know, there's certainly a very uncomfortable procedure associated with that and risks, hence why they needed the general anesthesia.
All right, interesting story. Brian Larsen of RestoraPet, thank you so much for sharing your expertise on this with us.
Thank you so much.